personal care for the last close to 3 years. So we've got a lot of good caregivers already on staff, and right now we're focusing on hiring the best caregivers that we can find, and then just talking to great groups like you guys and seeing what we can do to help you guys with your patients.
First of all, I wanted to tell a little bit about why we got into this business. We started doing this to help people like our parents and grandparents stay at home as long as possible. Try to keep them out of long-term care facilities, and most people want to stay in their own home. When I was young growing up in Nebraska, my grandma would always say to me, please don't put me in a nursing home. She said it a lot. Well, as she got older, she developed a slow-growing brain tumor, so my grandpa was her primary caregiver. When he passed away, then she lost that. My mom was a director of nursing at the hospital and worked full-time. My dad had a heating and air conditioning business, and he worked full-time, and which they had to make a living. So they had no choice but to put her in a nursing home, because where they lived, they didn't have any type of home care services there. So if they were to have something like this, someone could have came into their home and cared for my grandma until my parents got off work to where they could take over. So that's the real reason why we're here, is to help with those situations. People want to stay in their home generally as long as possible. We also are focusing on providing quality care. One of the biggest things in talking to people out in this industry that clients complain about is, I had a caregiver from such and such company come in to care for me, and all she did is sit on the couch and play on her phone. She didn't do anything. I've heard that over and over and over again. Our caregivers know that we won't put up with that. We go through a pretty stringent orientation process with them, and I'll go over that here in just a little bit. Talk a little bit about the services that we provide. In the brochure that I give you, this is the inside of the brochure, and this is all the services that we provide. So we provide personal care like hair, skin, incontinence care, ambulation, dressing, grooming, bathing, the typical ADLs that we all take for granted, to where some people just can't do on their own, and they need that extra help. We also provide companion care. If someone's spouse passed away and they don't have any companionship or don't have any family, we can provide that for them as well. We also do medication reminding. Some folks just get forgetful and don't remember the right times to take their medication. We have a client right now that's the main reason why she hired us, is because she can't remember. She knows what medications to take, but she can't remember when she's supposed to do it. So she needs help with that, along with a few other things. We'll also provide rides to doctor's visits. We'll do grocery shopping for them, things of that nature that they're no longer able to do. As far as our caregivers go, we only hire caregivers with experience, and they have to have one of the 4 qualifications. They have to be personal care aide certified, or they have to have a CNA license, or they have to have at least 1 year experience in a long-term care facility, a hospital, home health, or some type of home care. We also hire RN students that are in an accredited RN program, as long as they can provide documentation from either the director or the dean of schools. So, but they're more than qualified to handle this type of care. Once they've met those qualifications, we do pretty stringent background checks on them. We'll do a state criminal background check, a national criminal background check, sex offender registry search, healthcare compliance search to make sure they're not on the list that prevents them from working in a healthcare setting, social security verification, make sure they have a valid social security number, they haven't stolen somebody else's identity or social security number. It'll actually say on there if they're alive or deceased, so it can tell you if they're using a deceased person's social security number. And then we'll do an FBI criminal background check if they haven't lived in Arkansas for the last 5 years, and that entails them getting fingerprinted. Those fingerprints get sent off to the state and then to the FBI. So that can take 3 to 4 weeks to get back, but we do that because the other searches aren't as comprehensive as what they need to be if they haven't lived in Arkansas. And once they passed all the background checks, then they'll come in for orientation, and we have a lot of paperwork for them to go over. These are all documents that we go over with them, and they sign, knowing, so they understand what is expected of them and what our rules are. Some of those will include caregivers' duties and responsibilities, so they know exactly what's expected to them when they're caring for one of our clients. Employee safe working practice agreement, so they know how to recognize problems in the home or things that could cause accidents, fall prevention, things of that nature. We have a termination agreement that they'll sign, so they know exactly what's expected of them and what will happen if they don't follow our rules and guidelines. There will be corrective action, and they will be terminated if it's not corrected. There's a code of conduct in there that's about 4 pages long that has each one of our sections of code of conduct that we go over with them thoroughly. They have to initial each one and sign that when they're done, so they're well aware of what's expected. We have an elder abuse policy, so they absolutely know that any type of elder abuse is not tolerated. They'll take an elder abuse test, which will tell us that they understand how to recognize elder abuse in the home, whether it's physical, mental, or financial elder abuse. Like Sherry said, there's been cases out there where either a caregiver or a family member is stealing money from some of these folks, but we won't tolerate any of that. We also have a sexual abuse policy, and we give them a caregiver aptitude test. That tells us that they are experienced, and it helps us match them to a client, match their skills to a client. Once they went through the orientation, then our RN will go through each employee's file and verify that the employee's experience and their capabilities. And once she's done with that and she's satisfied with those things, then she'll sign off on it, and then they can go to work for us. So it might take, from the time they interview, it might take a few weeks before they can actually go to work for us. If you all know anyone that wants to start care for us, it's very simple. You can hand them one of our brochures, and it's really 3 easy steps. They can call our phone number to set up service, and one of our care coordinators will set up to come out and meet with them and go over the type of care that they're looking for. You can also call us, and we'll call them and set it up. So some places want us to come to their facility and meet with them, which we're happy to do that as well. Once we've done that, then an RN will come to their home, and they'll assess the environment and assess the client and set up the care plan. So the RN sets up the care plan for the caregiver to follow. So once that's done, then we'll monitor the care and set up a caregiver to come and care for them, and the caregiver will follow the care plan. During that process, the RN will come to the home periodically and supervise the care and make sure it's done properly and that they're following the care plan. A lot of people ask us what areas that we cover. We're licensed to cover a 50-mile radius, so we cover all of Northwest Arkansas, which is Washington, Benton, Madison, and Crawford County, as well as parts of Carroll, Franklin, and Sebastian County. So we'd be happy to help any one of your clients or anybody that you know get through their daily activities. So if there's ever anything that we can do for you, we'd be happy to do it. Does anybody have any questions?
Is it private pay? Or
We do, long-term care insurance will cover it,
okay.
private pay, and then we do Medicaid on a case-by-case basis. But there's a number of different types of Medicaid. So some of them we're set up with and some of them we aren't. So if we refer a client that has Medicaid, then we'll check out what type of Medicaid they have and see if we're licensed to do it.
Okay.
Yep. Okay. Well, thank you so much for having us. We really appreciate it.
Yeah,
Thank you.
Yeah, thank you.